Hello everyone, I am urologist Omar Erdamakaya. The subject we will talk about today is how to understand the degree of erectile dysfunction. There are 3 degrees of it as low, moderate and severe. Friends, normally in urology, we use a form called the International Sexual Function Index form. In this form, the sexual functions of the patient are evaluated by scoring. We evaluate this more objectively. Then, in the follow-up of the patient, we say that the patient has gotten better and his score has increased. But it is not possible to use this sexual function form in practice. We ask the patient the following. What is the frequency of sexual intercourse? Do you feel confident? Do you experience erection loss during intercourse? How are your erections in the morning? For example, let's say a 40-year-old man came to the outpatient clinic. While we expect sexual intercourse 2 or 3 times a week, if the patient says that he has sexual intercourse 1 or 2 times a month and has erection problems in these intercourses, it is a very obvious problem. Sometimes the patient says that he has not had intercourse for 6 months. Of course, people are reluctant to see a doctor. They hesitate to consult a doctor about this problem. Don't hesitate from the urology outpatient clinic. Because this is already the job of the urologist, his job is erectile dysfunction, you should be able to explain all your companies related to erectile dysfunction. Erectile dysfunction, the problem of not being able to have an erection, the problem of not having sexual intercourse is ultimately a problem of a couple. The female partner may want more sexual intercourse even if your cycle is normal, which is something you see frequently in newly married couples. Let's say the sexual cycle of the person is suitable for 1 or 2 intercourse a week, but newly married, of course, they can have intercourse every day. A newly married couple can have intercourse in the morning and evening. Of course, the person's cycle may not fit this. When he tries to have intercourse so often, he may experience erectile dysfunction. It is necessary to successfully adjust the sexual harmony between the couple. I think the most important thing is the most appropriate and successful frequency of sexual intercourse for the couple, rather than the degree of erectile dysfunction. The degree of erectile dysfunction is generally like this. Thank you for listening, best regards.